Mental illness is a problem that affects many people across the world. 35% of Ugandans suffer from a mental disorder and only 15% acquire treatment. The World Health Organization has recently reiterated the importance of mental health care as part of the coordinated approach to non-communicable diseases, which are increasingly affecting countries such as Uganda.
Mental health is often misunderstood in Uganda, and I think the message that is important to bring is that mental ill health is an illness like any other illness, and it can be treated and people can recover and continue on with good lives or returning to make good lives.
I have discovered in my visits that these people are already misguided. They need help. Wherever you find a mental ill person, the family is divided, marriage is broken because the husband may say it's your problem, or the wife may say it is your relatives or your mother-in-law, and there are conflicts in the family.
One of the problems of mental illness is that it is a low priority everywhere. In most countries, there is only a very small percentage of money that is spent on mental illness. And although the treatments are relatively cheap, it is important that they are available to people.
With its goal to promote mental well-being and to provide care, UPMB seeks to strengthen effective leadership and governance for mental health within member health facilities, to provide comprehensive, integrated and responsive mental health services in community-based settings, and to implement strategies for promotion and prevention in mental health. This will enable persons with mental disorders to find it easier to access mental health services, be offered treatment tailored to their needs by appropriately skilled health workers.
Uganda Prison Medical Bureau is an organization that was formed by two churches coming together. That is the Anglican Church of Uganda, or rather Church of Uganda, and the Seventh-day Adventist Church, Uganda Union. And their coming together was to form an organization that was initially established to be a channel of support to the health facilities that belong to these churches.
For some years, I have been coming to Uganda with Jamie's Fund to support hospitals and health services in this beautiful country to develop their mental health services.
But we believe that it is important for hospitals to be reaching out to these people and helping them get the treatment that they need so that they can become constructive members of society again, and that their families can return to a normal way of living.
This program started in 2013, where we realized that there was a great need of patients with mental health challenges or psychosocial challenges in our catchment area. We realized we were seeing very few numbers. So after realizing that, we decided to move to the community and start following up patients in the community. And at the moment, we are doing 20 outreaches each month to follow up these patients.
Most of the mental health services in Uganda are based in the regional referral hospitals. But Kisisi is out into the community, and for example, we now run 3 clinics a month for patients with mental disorders, and we will see between 80 and 120 patients at every visit.
At the moment, there were people who were chained up or locked up in houses or small rooms, but a number of them, in fact, we have already identified 50 of them. As I talk right now, we have 15 of them already released.
We started with 4 patients who were locked up, who were abandoned, who were chained, and who were at least recognized as human beings. If we can care for the others, and this hospital motto is life in all its fullness, then how about these patients who are neglected?
The hospital set up an inpatient psychiatric unit some years ago, but we're really excited this year that we've opened the new Ahamuza Centre, which is the hub of a whole network, including our community outreach. The centre was sponsored by a charity from the UK called Jamie's Fund, and this fund was set up in memory of a little boy who died a few years ago, very sadly. But wonderfully, his parents decided that as a memorial to him, they would set up this charity which has helped so many patients since then.
Community mental health, if promoted, if we can put our hands together with the government and policymakers to try and promote community mental health, that will reduce the burden of mental health in our communities, in the hospitals, and things would work better.
We are piloting what we have called our work therapy activities, where these patients or people who are recovering from alcohol challenges have determined that the time and other resources they have been using to acquire alcohol, they are going to use them into productive activities. So the hospital gave us a piece of land and we constructed a chicken pen and pigsty, whereby we have 200 chicken which are producing 5 trays each day. And this has really helped our patients who are being rehabilitated. We have 33 of them who are actively involved, but we have now a total of 48 of them. We are hoping that this one, if it works out very well, we want to roll it to the community, even to other patients with other mental health challenges, not only with drug or alcohol abuse. And we believe when we do that, with our excellent outreach and home visit program, we hope the patients in our immediate catchment area are going to benefit a lot.
I've met people in many countries who have suffered mental illness and who have come through back into light and life again. They're not useless. They can be really valuable members of the community with a little help and treatment.
Jesus called us as Christian people to set the prisoner free, and mental health or mental illness is one of those things that very often can imprison people. And by working with people on the ground in the hospitals, we can bring good mental health to people who have not known it and help to cure them and to bring them out of the darkness, as it were, into the light, which is what Jesus called us to do.
I really want to make an appeal to whoever is seeing me right now to come to our rescue, because in the whole of this diocese, we don't have any mental health care. We have already identified a place as a diocese to have a piece of land donated to those who are willing to help us. And we are partnering with the UPMB to help us bring these services nearer to us.